He has received numerous recognitions and awards, including the prestigious Presidential Rank Award for Distinguished Service, and has been inducted into the University of Connecticut's Academy of Distinguished Engineers and Hall of Fame. It's a pleasure to have in our webinar series. And Jeff, the floor is yours.
Thank you very much. I appreciate that wonderful introduction, and it's a pleasure to be with you. It'd been nice to be with you in person, but I'm glad I could be with you virtually. And what I thought I would do this afternoon is talk about COVID-19 impacts and implications. And I hope this can be more of a conversation than a lecture, because when you talk about this topic, it is so quickly changing and so much is happening that it's hard to be definitive about almost anything. But what I'm going to try to do is give you a sense of what I'm seeing right now and what that might translate to in both. We're meant to take a snapshot of where we're at as a country. And this is maybe a week or so old at this point, but I think we're seeing this shape in terms of the loss of life that is happening as a result of the COVID-19 pandemic. And we just saw the headline, I think yesterday or today, of the total loss of over 100,000 people, which is a tragic situation. But we can see the impact of the bit of the flattening of the curve here as we have gone under this kinds of stay at home and restrictions to try to mitigate the impacts of the pandemic. So the deaths are declining, but still very significant. We also see the impact across the United States is uneven. And I think this is important for us to recognize that this is not a homogeneous impact at this point. You know, we have several hot spots, which you can see. Obviously, the New York City metropolitan area was one that was very early and very significant, but also places like New Orleans and Louisiana and others. And the response, I think, from the governors and from mayors and other leaders has been to some degree in alignment with what they see happening within their jurisdiction. And this unevenness, I think, will impact and has impacted and will continue to impact transportation as we continue forward with this crisis. And this is the kind of sort of localized approach that I was referring to a minute ago, when you look kind of from state to state and you see, you know, kind of from the left, the light blue, where it's more or less open, all the way to the right where it's closed. And this is an area that is significantly shifting. Again, this was about a week ago. And I know I'm in the Washington, D.C. metropolitan area. One of the challenges here has been we have a mayor in Washington and two governors in the two states of Virginia and Maryland, and then county officials. I live in Montgomery County, Maryland, and each one has a role to play in setting the parameters of what's open or not, and there's a lot of variability. So when you're traveling around or you're in the Washington, D.C. area, figuring out what the rules are right now for almost anything is a bit of a challenge, because there are so many actors involved in the response. So how has this impacted transportation? Well, again, here's a snapshot of information gathered from a variety of sources. And I will show you as I get to the end of the slide some resources from ITE if you want to follow some of these kinds of trends and information in a more updated manner. But if we start with air travel, right, we've seen significant drop in air travel in the 90% range. There's some limited recovery starting, but relatively slow. Similarly, mass transit, public transit, very dramatically impacted, with rail travel in particular down in the 85 to 95% range. And really the use of transit right now is by essential workers and those who really don't have any other travel options. And that gets into questions of equity considerations as we go further along in this. When we talk about traffic volumes out on the network, on the surface transportation system, we see pretty steady maintenance of truck traffic because a lot of what we're consuming and getting is coming to us via truck, right? As it always has, but even more so these days as there's more at-home delivery and use of Amazon and all of those kinds of things. When we look at the automobile volumes and passenger travel, the most dramatic drop was in late March to late April. In that window, we were at kind of 50 to 60% of the prior year levels. That has moderated some. By mid-May, we were up to 75 to 80%, and I would guess today, we might be closer to that 80, 85% in many places. Safety, you would think with those kinds of drop-offs in auto volume, we would see dramatic drops in fatalities. And while we've seen some decrease, the first quarter of 2020, we saw fatalities down about 8%. In that same period, we saw the fatality rate up 14%. And a lot of that is attributed to higher speeds. With lower volumes, people feeling the freedom to travel at higher speeds, enforcement down. I think I saw something that the number of tickets written was down like 90%. So there's a reluctance to enforce only the most egregious, I think, of traffic violations, and that is giving people the feeling that they can drive at much higher speeds. I know, having driven some out on the interstate around this area, you can see it very clearly. And then finally, open streets. So one of the things we've seen is a dramatic increase in the desire for walking and biking, both for short distance travel, but also for exercise and activity. And so many jurisdictions have opened hundreds of miles. I think the latest I saw in the US was probably over 500 miles, increasing daily, really, of streets that have been opened to biking and walking. And there's, on all of these impacts that I cite, these are the short-term impacts, but there's some longer-term implications that I'll talk about in a minute. So what are our short-term expectations? And I define short-term as kind of pre-vaccine period. And recognizing we don't know how long this period might be. I think at the most optimistic, we're probably talking 8 months. On the other side of it, maybe we're looking at 18 months, somewhere in that range. So this is not something that's going to resolve itself immediately. I think we will continue to see conditions vary regionally. Places like New York City, I think, have seen significant improvement, but we've seen rise in hotspots in more rural areas now. There is some speculation that as we get into the fall months, where we typically see flu season, those kinds of things, that we could see a reemergence of the virus, which could lead to, if not widespread closures, certainly localized closures. We have lots of people working from home, right? And while that is beginning to shift back to some movement back to physical workspace, that's going to be very slow, I think, during this period. And an estimate that I saw was that about a third, somewhere around 30% of all workers are remotely enabled. That means they have a job and they have the technology that would allow them to work remote. And so one of the question is, how many will continue to work remotely exclusively or largely? I think a lot of them will. And we've seen some of, particularly the tech industry in California, announce that they don't expect to bring anyone back to the office until at least 2021, till next year. I think activity, transportation and demand and activity will be determined by individual risk assessments, not just openings. And we've seen some of this. Georgia was highlighted as an early reopener, but information that I've seen tracking people's movements through cell phone usage and other things have illustrated that the patterns of individuals in that area, in that state, are not that different than from ones that are still closed. That people are making individual risk assessments and judging where they will go and what they will do based on their own personal judgment, not just because something's opened or closed. And then obviously the activity, I think, will be generational. Young people, I think, perceive this as lower risk to them, and it is to some degree, and are more willing to take risks. Older people have a higher risk if they contract the virus and are going to be more cautious. And again, we've seen some of that play out as we've seen people on beaches and other places like that. So what happens with transportation if that's the situation we're looking at over the next 8 to 18 months? I think overall we're going to see passenger transportation demand remain depressed, and that includes certainly for things like air travel, long distance travel. I think will remain dramatically depressed. I think freight transportation demand is probably going to stay at or maybe even above, historical levels, above where we were because of this continued demand for goods delivered, to our homes and by um, truck and package delivery, those kinds of things. Transit service and use is really a tough question because it's a little bit of a chicken and the egg, right? How much service as transit properties have significantly scaled back service because demand dropped, how much service will they put back in place knowing that the demand is probably going to continue to be depressed and that their primary riders are going to be essential and service workers with limited options, as opposed to downtown commuters, for example. Micromobility options and usage. I think they're going to remain limited, although perhaps important if people can feel comfortable taking bike share, scooter share, those kinds of things in lieu of taking transit trips, perhaps. So I think there's some questions about micromobility, but it's a fledgling industry and they've certainly been hurt economically by the COVID-19 crisis. Biking and walking, I think, will certainly continue at elevated levels, both for short distance travel and for exercise. And then I think we're going to see single occupant usage increase as a percentage of mode share. But if I think about the percentage of people that will be working from home and think about the percentage of people that will be driving alone, I don't expect congestion to increase. I don't think in this near term period you're going to see that sort of gap that's created by the work at home totally filled by people that are now driving alone. And overall, I think we'll see fatalities remain down, but I can also imagine that that fatality rate remains elevated until we get to the point where we have some more traffic on the road and some more aggressive enforcement. I think we're going to continue to see that elevated fatality rate, and that's going to be a challenge, I think, for transportation agencies as they try to encourage drivers to travel at safe speeds. So those are some of the what I would call short-term pre-vaccine impacts. What about the longer term questions and implications? So these are here where we're talking about not only in that pre-vaccine period, but even after we get a vaccine, say, or even after people treatments or other things where the risk is lower, maybe not zero, but the risk is lower. What will be the lasting impacts of COVID-19? And this is, I think, one of the big questions. I think this is a question in terms of the economic recovery. Is it this V-shaped type recovery we wish and hope for, or is it more of a U-shaped recovery that drags out longer? One of the things I think we will see reduced long distance travel and continued reliance on video conferencing and technologies like this. We've all gotten more comfortable to it. To me, it's been surprising that we are able to use the technology as easily without significant bandwidth problems, and we become very quickly pretty comfortable with it. I think there's going to be a real question about, do I need to take that trip if I want to do a 1 hour lecture with the students, in Florida at your university? Does it make sense for me to spend a couple days or a day and a half on plane trips in both directions to spend that hour with you, or is this a better use of my time and maybe a safer way to operate? I also think we're going to see organizations, both public and private sector, that are hit as a result of the economic impact, reduce travel budgets. And so that's going to make it also, I think, reduce long distance travel from a work standpoint. From a leisure travel standpoint, I think people are going to be judicious and cautious. Some may go right back to wanting to get on that cruise ship and fly there and go to that. But I think many others will perhaps opt for different kinds of vacation or a little bit different lifestyle for a while. So I'm not sure we're going to go right back to where we were. I talked a little bit before about work from home arrangements and this shift to permanent, on either a full or part-time basis. And I think we will see some of this. It's certainly not going to stay at anywhere near 30%. But when you look at where we were, and I forget the exact percentage at the start, but it was down in the low single digits. I think we're going to see a much higher level of people working from home, partially because of the experience, the widespread comfort with technology tools, and the connectivity that everyone now has. There's increased, I think, employer confidence in managing employee productivity remotely. We've had to do it, and so you had to figure out how to do it and put mechanisms in place. And that's always been one of the barriers. If I can't see you, how do I know you're working? Um, and so, that I think we will have gotten past some of that, not all of it, but some of it. And there will definitely be increased worker desire to work remotely. And that may be a differentiator in terms of where I want to work, in terms of the flexibility I have to work from home at least part of the time. So if those things happen, then does that reduce demand for downtown office space? I think this could definitely cause a lot of organizations to rethink how much are we paying for that office space? How much is that space used? How well did we operate in this period without that major investment in that space? Could we operate just as well with less space or no space in a downtown business district? And what does that translate to us in terms of saving? And if there is a move in that direction, then what happens to the restaurants and other businesses and parking and all of those things that support workers, commuters that are, regularly going in and out of a downtown urban area and utilizing those services? And how does it change the demand for micromobility and for transportation network companies, Uber and Lyft and others? Is their demand depressed if we don't see as many people in the urban areas on a daily basis? I think these are all questions that and potential implications. A couple other, I talked earlier about this mode shift away from mass transit, and very clearly we've seen this, and I think this could be a long recovery, a very long recovery um, for mass transit, both rail and bus, and this move towards single occupant vehicles. And already there's been some discussion within the transit industry about the rationale for, and as I mentioned earlier, the availability of transit. Does it go and serve all the same places on the same frequency that it did before? Probably not. And what are some of the equity considerations there if for people who are transit dependent? And how do we make sure that they have access to transportation and access to jobs? We could see, I think, in the long term, a potential increase in congestion and parking demand. So if we see that economic recovery and we don't see people as willing to move back to transit, then that could, over time, overwhelm that piece of the transportation demand that is now working at home. So I think in the short term, probably not, but in the long term, possibly. And we've already seen some cities, jurisdictions talk about making this increased space for walking and biking permanent. And there's a lot of voices speaking very loudly about the inequity between space provided for vehicles and space provided for people walking, biking, scootering, and the need to rebalance that. And then last, but certainly not least, is the funding for transportation, because that can affect a whole bunch of things. There have been a number of discussions about a potential federal stimulus or investment in infrastructure, either through a stimulus or reauthorization of the federal transportation program, which is due to expire in September of this year. Just yesterday, I think Governor Cuomo from New York was in Washington or in conversation with the president and urging the president to encourage advancement of legislation that would put significant dollars into transportation. Again, it's been talked about a couple times, has not come to fruition yet. I think it's certainly possible. That could have some significant implications for the transportation industry and investments in transportation. On the other side, we have the budget pressures, which are already present and sure to intensify at the state and local level. Lots of resources have gone to responding to COVID-19, continue to go to responding to COVID-19. And those resources are going to put pressure at the state and local level, who have to have balanced budgets. They don't have the luxury of deficit spending to cut other places, and transportation, workforce and transportation investment could be one of those places. And then the length and shape of recovery that I talked about earlier. The longer we go in a period where we don't have a vaccine or we don't have treatments for COVID, and we have a feeling of continued risk and a dampening of economic activity, is going to lengthen the recovery. And I think that it will have implications both in terms of use of transit, but also funding support for transit. So kind of wrapping up here, I want to talk just briefly about ITEs response to COVID-19. And we've done several different things. Hopefully you've seen some of this, and I would encourage you, if you haven't, to take a look at it. One of the decisions we made early on is that we thought we could be an effective clearinghouse for information, some of which was coming from us, but also information coming from others. And so we've created a COVID-19 resource page where we've tried to curate it a little bit, evaluate the resources, provide a short sense of what the resource is, and organize them into 4 different categories. Information about kind of what's happening in transportation, information on transportation impacts. So some of the kinds of statistics and data that I showed to you today were drawn from different resources that are available on our webpage. Organizational tools, so information that organizations in the public or private sector need to operate in this time, and information for individuals or for families. So we have all those kinds of resources there. It's updated regularly, and we encourage you to check that out. We've also done some deeper dives on topics. We have a monthly podcast, and we pivoted on that podcast and did one last month on the future of transit with Paul Skatelis, who is my counterpart with the American Public Transit Association, and him looking at the impacts of COVID-19 and forecasting out of it. It's a great listen if you're interested in that topic. We did a webinar through our Learning Hub series, getting 3 jurisdictions. I think it was Oakland, California, Calgary in Canada, and Burlington, Vermont, talking about their approaches to opening up streets for walking and biking, and lessons learned and how they went about it. A recording of that is available. And then we put together a new working group that our president, Randy McCourt, is leading, and includes representatives from across the industry, looking at issues of traffic counting and traffic estimation during this period. You can't just rely on historical trends. You can't just use data collected today. How do you put those together if this recovery is going to be over an extended period of time? And so we would hope that would produce some guidance here within a relatively short period of time, certainly this summer. We've created some new engagement opportunities because we knew people were at home and they would take advantage of some of the webinars and other training we are doing, but we wanted to give them a kind of a more unstructured way to interact. And so in March, we started a virtual drop-in session. This is done, in March, it was done Monday through Thursday. Currently, we're doing them on Tuesdays and Thursdays. And they're 30-minute sessions on various topics, sometimes COVID related, sometimes not. There can be led by anyone. So if students as well, if you have a topic that you're interested in having a conversation with a group of folks about, the leader takes kind of the first 5 minutes or so and presents the issue, maybe presents a little bit of information, asks some questions, and then it's kind of an unstructured focus group discussion around that topic. We record them so folks that weren't able to sit in can listen and follow. And we've done a wide variety of subjects. I encourage you to check it out on our webpage. And then finally, we just announced last week a reimagined ITE annual meeting and exhibit. So our meeting, the physical meeting, was to be in New Orleans in early August. It's going to be a typical conference and exhibit. Obviously, with travel and health concerns, we had to cancel that physical meeting in New Orleans, but we wanted to deliver the great content we already had in place to our members. And what we decided to do was step away from the footprint of the 2 or 3 days that we had set aside for that meeting and deliver the meeting through the first 3 weeks in August. So the first 2 weeks will be plenary technical sessions, poster presentations, and workshops. You see, there'll be only Tuesday through Thursday and from 11 to 5:30 Eastern time to allow people to balance work responsibilities with this learning opportunity and to respect time zone differences, those kinds of things. In conjunction with the meeting, we're going to have an exhibitor showcase. So we'll have more than 50 exhibitors that will have the opportunity to interact with participants and be involved. And the exhibitor showcase will be open to all IT members without charge, and that will go on throughout the month of August. So there'll be an opportunity to participate there. For the annual meeting and exhibit, I think for students, the charge is only $50 to register for the full meeting, and there will be a number of scholarships available as well. So I would encourage you to check it out and take the advantage to participate in the annual meeting exhibit. All of the sessions will be recorded. So while we'll have some concurrent sessions going on, if you can't participate in one because you're not available or you're in one of the other sessions, you'll have the opportunity after the fact to catch up on some of the information that you missed. So those are some of the things that we did to respond to COVID-19. And here's the link to our resource center and the information that we have available on COVID-19. So with that, I appreciate the opportunity to share that with you and hope we can spend the second half of this session in conversation about this information and your perspectives on COVID-19. I'm certainly interested in kind of in a university setting, um, how things have gone and what you're thinking about both as students and as academics as you look forward not only to the fall but in the long term in the university environment as well.
Thank you, Mr. Paniati. So now we will open the floor to the questions, and there is an interesting discussion going on here in the chat, which one participant asked that several years back, HP, Facebook, and Yahoo all reduced or eliminated telecommuting because productivity was down and people actively wanted direct iterations. And would COVID change this?
I think it already has. I think you've seen some of those tech companies. I think Facebook is one that has already said that they're going to allow people to decide, whether they want to come into the office or not. And I think that's pretty dramatic if it's all the way at that extreme. I don't know that everybody's going to go there for the long term. I think for the short term, certainly in the tech industry right now, I think you will see very few people in an office setting in 2020. As we move into 2021, some of that might shift back, but I don't think it's going to go all the way back to where it was. The challenge is finding that right balance, right? Because it's been interesting to be in this environment and to get a sense of the kinds of things that you can do using the technology and being remote and some of the kinds of things you can't. And I just in this past week, I was on several video conferences, one an international one and a couple other domestic ones. And in each of those, there were some people that I knew and had worked with before, and there were some people that I didn't. And I was reflecting on the conversation and the engagement with the participants and those that you have worked with before, particularly those that you have been at places with and you've had hallway conversations or you've had dinner with or you've gone out with a little bit, the relationship you've developed in that environment is hard to replicate, I think, working just remotely. So it's hard for me to imagine that we can be as productive and as effective only working remotely. But I think we're going to shift that needle significantly from where it was in January of 2020 to where it will be, say, in January of 2022.
Yes, thank you. Does anyone have any question for Mr. Paniati? Well, since no one is manifesting, like I would like to ask, what would you think it was our biggest weakness before this disruption?
Biggest weakness in terms of the transportation system?
Yes, transportation, supply chain in general.
Mm-hmm. I think in some ways, we were bound by that physical system, right? So if you think about urban travel, you're very much tied to transit systems that were designed and built in most of them fixed rail and suburb to downtown direction. So we're already challenged as cities were growing out to be able to travel radially and, circumferentially rather, to suburban activity centers. So, in the Washington, D.C. area where I am, the metro system does a great job if you want to go from any of the suburbs to downtown. But if you want to go suburb to suburb, where there are lots of people that commute and move, not so much. And they're in the process of, in where I live in Maryland, trying to fill that in with a new light rail line. But I think we're kind of hardwired into some of our patterns in travel, and some of that also certainly created inequities for some part of the population in terms of where they were not being well served by the system. And as we step back and maybe have the opportunity with this to relook at the way we want to travel and the travel options available, I think it will cause people to rethink a little bit about some of the transportation planning we've done and investments we've made, and do they serve our future needs well, and do they serve all of our citizens well? And as I mentioned earlier, there is going to be, I think, some tension between or about providing more access to walking and biking. I think there's going to be a relook at underserved communities and what could be done to support them. Ironically, one of the things that was really helping connect people was the micromobility, the scooters and bike share. Some clear studies that show that folks from underserved populations were being able to use those to get access to the transit system or bus system to be able to get to jobs and get to shopping. So I think we have an opportunity to rethink a little bit about what are the right set of investments going forward, and are there some opportunities perhaps to better balance between the various modes and between different areas within our communities, and to better support and serve them. Um, so it's a matter of whether we decide to take advantage of those opportunities or we fall back into our kind of traditional patterns.
Thank you. In the chat here, we have a comment from Charles Edwards, which would be the difference between 1918 and now is that they did not have the technology we have, which can facilitate working from home. And there are companies which say that employees prefer to work from home, and some places have experienced sales are up as their manufacturing plants are working overtime, but the sales and administrative functions are all online. So it all depends on the type of company, I guess. How prepared is the team? Also, we have another question. You want to make any comment on that?
Yeah, no, I would like to. I do think that um, it's a great observation from Charles, and I think it mirrors what we're seeing, which is people that were equipped with the technology and the nature of the work lends itself to remote work. I think this has thrust them very aggressively into that world, and they've learned a lot of things, and they may have recognized, as he is pointing out, that there are some significant benefits to operating in this environment, at least to the organization. Employees, I think it varies. I know with my own employees, some are very comfortable working at home and would like to stay at home. I have several that want to go to the office as soon as they can for a variety of reasons. They either don't feel as productive as home, they need a change of scenery, they want that, that kind of more definitive lines between their personal and professional life, and that they can blur pretty dramatically at home. So I do think that it's going to be variable, and we shouldn't think that it's going to be a one size fits all. For some companies, that may be exactly where they stay. For others, it may be somewhat different, but I think that's a great observation.
Okay, another question that we have here, it's from that in the near term or long term future, will transportation organizations start to take a more holistic and comprehensive approach toward the planning, design, and operations of a hybrid mobility teletravel system?
Yeah, I think, that, thank you, Martin. Good to see you online. I think that that goes a little bit to my earlier comment about the opportunity we have in this coming period to rethink or to think about our transportation system. And do we take the kind of view that Martin's suggesting, which is a holistic, more comprehensive approach? Because I think if we do, we might come to some different decisions and different outcomes. I don't know. I hope I can be optimistic and think we will. And we are seeing even today, Vancouver, British Columbia, the city council there, I think, made a decision to permanently open or provide 10% of the urban space, travel space, to alternative modes like biking and walking permanently. So I do think we are seeing some changes. Whether those changes will be done in the holistic, comprehensive way that Martin's suggesting, I don't know. I'm probably more pessimistic that we'll do it as well as we should, but hopefully we will move some of it in the right direction.
Thank you. We have another question here. It's from Dr. John Hurdos. It's, what do you think the changes in rural transportation and accessibility needed to handle better working from home and other activities?
I think the biggest issue is the access to high-speed communication. That I talked about the bandwidth being really good, and I think that's true as long as you're in metropolitan areas or even suburban areas. If you get to truly rural areas, that's where there have been several broadband initiatives to try to bring the kind of connectivity that many of us take for granted everywhere we are, that doesn't exist. And to be able to work from home, I think that's going to be one of the keys in that kind of environment of whether you can or you can't. In terms of transportation, rural transportation, there are limitations. And I think those limitations will remain in terms of travel by other than the personal vehicle. And that's a real challenge for elderly, for example, in rural areas, and getting access to healthcare. The limitations on, you know, ride services can be really challenging, and I worry that in the economic climate that jurisdictions are going to be in, whether those might even suffer more. So I think that we're going to see variable impacts in rural areas.
Just to jump in, as a kind of follow up to my question, this is John Hurdos. Also, I'm interested in people that are not tied to the office will be able to theoretically move to a more rural area where the expenses for living are cheaper, since they're not going to have to do a very long commute to the office. But on the other hand, that rural area has to offer them the same, how should I put it, resources.
Yes.
FedEx needs to still deliver packages to me, and UPS, and I still have to be able to receive the same things that I need that I normally buy on my way to the office or when I am closer to the city. But in rural transportation in Minnesota, for example, in the winter, a lot of rural areas are cut off because the roads are undrivable.
Yeah, I think you could see that move more to smaller cities than truly rural, which might bring that balance between, I can get away from the congestion or the expense of the really big metropolitan areas and get to some of the smaller cities which are known for their livability already and provide a lifestyle that people might be looking for because they still provide that connectivity I talked about. They have reasonably good medical services. They have some level of the cultural activities that people are looking for. I think those could potentially be the beneficiaries, or those I wouldn't call second tier, but second tier in terms of size, or even third tier size cities that are known for that, and that's where I would expect that you might see the kind of thing that you're describing take place.
Thank you, Dr. Hurdos. Now we have a question from Dan Murray, which will be actually a comment, which is in freight, activity levels are determined by the economic impact of COVID in specific sectors. An example is that no one is driving, so no spending, gas, petroleum movements are extremely low, and food, paper products, and medical devices are way above normal.
Mhm.
Would you like to make a comment about that?
No, I think that's a great observation. I think we're all still, although I think it's normalized. I know in my local grocery store, you still can't find certain kinds of flour and baking products and things like that, even after how long it's been. So there are it's variable in terms of the products and the availability of those products and the um, distribution system. It's been interesting. Some of the things I read, talked about, some of the challenges were the fact that I don't know if it's exactly right, but around half of the um, supply of food products went to restaurants of various kinds to then be delivered to consumers. And so once you had everybody staying at home, cooking at home, and wanting those same products, a lot of the products weren't packaged and the distribution system wasn't set up to deliver the volumes to grocery stores. In retooling that is what caused the problem. Wasn't that there's not enough of the product, it isn't enough of the product packaged in the size and into the distribution system in a way that was aimed at consumers. I thought that was an interesting, observation or understanding about why can't we get certain things in the quantities we want in the place we want, because it was a significant change in the distribution system and the production system.
Thank you. I have a question here from Brandon Fleming. Is this the best opportunity for pedestrian and bike facilities to take over some roadways? The city of Miami Beach closed Ocean Drive in the popular South Beach area to vehicles to provide social distancing. Do you foresee pedestrian and bicycle facilities funding increasing?
I think at the local level, yes. I do think that this will cause some increased investments within cities and those jurisdictions. The question I have is the degree to which roads will be permanently closed or lanes will be taken over to widen sidewalks or to provide more space for micromobility options. And that may somewhat be dependent based on demand, right? Vehicle demand and the ability of the advocates for increased space for biking and walking to make their voices heard, because there's always sort of a push-pull between those communities, and the challenge is trying to figure out what the appropriate balance is in the limited space available. There are certainly people that believe we have dedicated far too much space to moving vehicles and far too little space to moving people. And but that will be interesting to see the political will within jurisdictions to make decisions that provide more space for biking and walking. Even right now, temporarily in Washington, D.C., for example, they're going to allow restaurants to take part of the sidewalk and even curb lane space to provide outdoor dining because of the limitations on indoor dining, in this period. Does that become more of the norm, or is that really truly just a temporary thing? I think, there's a lot of in an urban space, with tight urban space, it's a real challenge, and it will be interesting to see how that plays out. It goes to some of that discussion earlier about the transportation planning process and the decision-making process.
Thank you. I have a few more questions here. One is from Nihat Ahmed. How will this how will this relate with the all new semi-autonomous and fully electric Tesla semi-truck after COVID in the transportation industry?
Yeah, I think we're going to have to see what the impact of this all is on connected and autonomous vehicles and the development of those and the advancement of those. And I don't know that I've seen much written about that in trying to forecast the impact. We know we have truck driver shortages, and so the trucking industry is certainly interested in semi-autonomous or autonomous trucking as a way, particularly long-haul trucking, to be able to mitigate some of those driver shortages. And when you get to personal autonomous vehicles, the thought has been that the way that we will see them first deployed are in fleets, not individual ownership, but more fleet ownership in urban areas, and perhaps circulating fleets and ways to use them in that arrangement. How this all affects that is a good question. There's certainly a competition for curb space, for example, for pickup and drop off. And we were just talking about, well, if we're going to use some of that space for restaurants, or we're going to use some of that space for biking or walking or scootering, and we want to use some of that space for traditional transit pickup and drop off buses, and we want to use it for autonomous fleets, for example, or non-autonomous Uber and Lyft. There's some real challenges there. We've been doing some work at ITE on curb space management in kind of the pre-COVID environment, and have some, I think, good guidance, and are in the middle of some additional work. But I think there's some real questions on like this, on the impacts of COVID on many things, and autonomous trucks, autonomous vehicles, and just kind of the regular environment. And I'm not sure we know yet, is probably the bottom line.
Mr. Paniati, this is Nihat Ahmed. I'm the one who asked the Tesla question. Thank you for your answer. Actually, you're right. There's not a lot written on it. I'm actually getting my PhD right now, and I'm trying to probably do my dissertation on this topic, that how all this does affect not only Tesla, because the Tesla announced the first one, but then Nikolai also said they're going to launch a fully electric semi-truck as well, which will be semi-autonomous. And as you were saying, for the driver wise, absolutely right. They're having driver shortages because they have a lot of fatigue while driving those team geared, diesel transmission trucks. And it's very loud in there. I've been there once. And so I think that having a fully electric, it's the Tesla claims to be the safest truck ever. So that'll probably not only reduce accidents, but probably may get more drivers involved who like to drive, and maybe they can cover longer distances. Because right now, I think there's a federal law that a driver can only drive so much because of all the fatigue, which might cause the accidents. So you're right. There's not a lot written on it, but I'm very, very curious to how this is going to play out.
Well, that's a perfect area for research, right? When there's not a lot written on it. So that's a good thing from your
Yes.
perspective.
Yeah.
I think you mentioned hours of service is what it's called in terms of the limitation of driving, and there was just some relaxation of that or some adjustment of that by the Federal Motor Carrier Safety Administration, which is part of U.S. Department of Transportation. But it doesn't really resolve the issue. It just puts a different spin on it. I think we are certainly moving toward an autonomous electric world. Before COVID, I would have said in a shared autonomous electric world, because that's kind of where we were heading. The shared becomes more of a question in this environment, but I think autonomous and electric in a lot of different forms, not only trucking but others, is definitely the trajectory we're on. So that's a great place, I think, to do some research because that's really about the future.
Thank you so much, really, Brad. Yeah, thanks for saying that because, as you said, like that makes my dissertation topic more solid. That maybe I should just pursue it because there's not a lot researched on it yet.
Mhm.
Thank you.
Sure.
Thank you. I have a question here which relates to the last question, which is how do we validate driver shortages? Who is tracking this? This is a question from Autumn Young.
The American Trucking Association probably would be the place I would start. They represent the trucking industry in a variety of different ways, sort of like ITE does, but more on as a trade association side. And they're very on top of driver availability because it's so critical to their industry, right? To be able to succeed, they have to have the availability of drivers. And so they've done a lot, I think, in trying to encourage drivers, recruit driver, people into the industry, all those kinds of things, and to testify before Congress about it. I think it's one of the arguments for changing the hours of service and lengthening hours of service is because there aren't enough of drivers to go around. So I would start with the American Trucking Association, and you probably also find some things under the Federal Motor Carrier Safety Administration website.
Thank you. We have one last question before we go.
Sure.
This is from Dr. Sharad. Will this change need to personal transportation permanently, which would be a good news for the global carbon emission?
Yeah, I think the climate change and carbon emission is an interesting one, right? So obviously we've seen some dramatic pictures and discussion about the um, air quality as we and the just the visibility as we've had this drop in vehicle use in particular and travel. And but at the same time, probably the discussion on climate change, I wouldn't say it's got pushed to the side, but it's got pushed away for the immediate term because there's so much focus on this issue. I I think it will be important again as we begin to come out of this and begin to think about our future investments in transportation, particularly if, for example, there was a big transportation stimulus program. Are there things we can do in our transportation planning and our transportation investments that move us in the right direction to reduce and keep global carbon emissions down? And that's going to take some political will and some good, I think, decision making and strong advocacy if we're going to get to those places, and both citizen advocacy as well as organizational advocacy. So I hope going back to probably Martin Petruka's comments and questions and my earlier comments, I hope that we can see this as an opportunity to reshape the way we deliver the transportation system for the future and take advantage of what is a crisis situation to perhaps pivot to a more positive direction.
All right, thank you. We're running short on time. So thank you, Mr. Paniati, for this valuable presentation and discussion about this novel theme that has been challenging us all. Even the most experienced transportation engineers are having to learn how to deal with it. We must be prepared for what's to come in terms of planning, research, funding, and overall being prepared in the future. Thank you, Mr. Paniati.
It's my pleasure. Go ahead.
Jeff, I'm sorry. John Hurdos, Dr. Hurdos has the last question.
Oh,
If
sure.
you-
I'm in no
we-
hurry, so no problems.
That's okay. If you're running out of time, my question was, I'll say it quickly and maybe people can ponder on it. In the pre-COVID world, there were a lot of development and investment regarding express lanes, hot lanes, BRT facilities. Some of these projects, multi-million-dollar projects, are already under construction. Some are in the state 10-year transportation plans. Should we pause them now that the world might be completely different? They were designed based on a travel demand knowledge that might not be valid anymore.
Yeah, that's a really good question. And I think a really tough decision for jurisdictions. It probably is going to depend on where they are in the pipeline as to their ability and the impact of trying to stop them. If it's already in construction, I think people are going to go. If it's in the design process, particularly with the budget pressures, it may cause people to stop and want to pause, if not cancel, but want to pause a bit on moving forward with some of those. It's going to take a while, I think, for us to figure out what the future demand looks like and how much we recover back to where we were, or we get on some kind of new or different trend line. I know some of the public-private partnerships that are relying on user revenue, toll revenue and other things are struggling right now in this situation. And, it will be a question as to, is that, how viable is that model going forward as, an avenue for attracting investment if we see, depressed demand. So I think that's a really good question. And I think some of it's going to depend on, kind of what happens going forward. Let me just last closing comment, and just to thank you for the opportunity to be with you. I think it's great to see an active ITE student chapter like the one there, and active professors who are willing to support it and to guide our students and to participate in sessions like this. So it's a great model for us, and I'm really pleased with the leadership that you all are showing within the industry and certainly within ITE, and thanks for the opportunity to be with you.
Thank you so much, Mr. Paniati. I didn't know what would happen after 2 p.m., so it's glad that I know now that we just go on.
It didn't cut us off. We're okay.
Yes. And also, Dr. Kaiser, would you like to make any comments?
I would like to thank everyone that participated in this FMRI ITFAU webinar series. We are going to have continuously, I think 2 per month, and we are going to advertise in our website, and you are probably going to receive emails from us. Jeff, I really appreciate your time. I know that you are really busy. Really appreciate it. Was nice. We connect back again for that we haven't talked for a few years. Really appreciate it. Was really interesting presentation. Really interesting, and really thank you for your time.
My pleasure. Great to talk to you, and again, hopefully we can see each other in person before too long.